Time.
Doc, may I ask how about to cure the fungus in the lungs? So the more common fungus in the lungs, it's called aspergillosis. Okay, so sometimes what I tell my clients there is that they can use they can use apple cider vinegar to drink. They can also use honey and cinnamon. Mega dose vitamin C. Of course, the best mega dose vitamin C. Always, if there's one thing that you can drink, for me, if there's one thing that I will drink, it's mega dose vitamin C. Okay, especially if you're stressed out. You have so many problems, if your immune system is low, you're always having coughs, colds, and fever. The best thing there is vitamin C for me.
Says, hi, Dr. Farrah. What can I do for mom? She's 68 years old and has non-small cell lung cancer. What are some things she may try?
Okay, you may try asparagus, yes, guyabano leaves.
Guyabano leaves.
Yes, so you can try that. Garlic, ginger, of course. So, if you look at the research about garlic and ginger, they're actually one of the most researched herbs. Yeah, and I think garlic has hundreds of research.
Thousands.
Yeah, hundreds and thousands, because I was reading it. It's very effective for cancer and a lot of lifestyle diseases. So you might want to try that. Okay?
And, obviously we've had a significant number of people in the past who, just by coincidence, taking Boston C, megadose vitamin C, and Pixidas magnesium, have seen a return to health in a situation like that, just by coincidence.
Yes. It's not enough.
Tuberculosis, because the person was asking, they were suggested to take the 6-month dosage of medication from their doctor.
Well, I'm not telling you to stop it,
Nope.
but it has many side effects. The side effect can be damage to the liver, optic neuritis, so you can have problems there. What you can do, because there are research that says that alagaw is very effective for tuberculosis, so you might want to try that. Okay. Okay, so Miss Rosary Pearl Castillo for asthma. Okay, me, I'm asthmatic. Okay, the last time I had an asthma attack was when I was 16 years old. I'm already 40 years old right now. Wait, ayan. So mag-41 na ako. Lapit na. So, it was so severe. Nako, Diyos ko. It was so severe. It was, you cannot, so I feel for you, for all of the asthmatics. So when I was young, I was taking a lot of synthetic medication. Now the problem is, nagkakaroon ako ng nginig. So I have tremors, palpitations, because of the side effect of the medication. So I shifted to eucalyptus oil. So lagi ko lang minamassage yan sa chest ko, sa back ko. Pagka nahirapan na akong huminga. And I also drink honey and cinnamon. So yun po yung pinakamagaganda sa asthma. So lagi ka lang merong minamassage dito sa chest, tsaka po sa back po ninyo. Have allergy, again, the best thing there is honey and cinnamon. I love honey. Those are one of the few herbal medicines that I can drink, because I'm very, very particular with the taste. Sometimes I really cannot take them. So honey and cinnamon, if you're having an allergic reaction, if you have bronchial asthma, or if you're just basically having a bacterial viral infection, the best thing that you can take is, of course, the honey and cinnamon. Gamata, Doc, weak lungs.
June Acuna. Hey, June, Reg.
Yes, hi, June Acuna. So for weak lungs, the ones that I would advise is you can do asparagus, diba? So I think I did some videos about that, where we did some asparagus paste.
Oh, yeah.
And you can eat it like 1 or 4, 6, how many times that you want. And then you can also use my...
You gotta admit though, it's tough to get past the first time.
Yes, but you would love it after that. And then siling labuyo can be used for weak lungs, oregano. Now if you're like me, I used to have asthma, bronchial asthma. What I did was honey and cinnamon. And that's the thing that I give my children as well. If they're having fever or they have some form of viral infection, honey and cinnamon, if they are more than 2 years old.
Hello, Del Rosario and Saudi Arabia.
Stage 4 lung cancer, Doctora, what is the protocol? Again, food. You change the food, no sweet foods, okay, no sugar. And then Boston C, vitamin C, ginger, garlic, and guayabano leaf. So that's the protocol. Dr. Farrah protocol.
Regarding lung cancer.
Ooh, lung cancer.
So let me just let's introduce a situation. Let's say someone has stage 3 or stage 4 lung cancer. What would you recommend for them? Let's say, for example, let's say you're in the Philippines. Okay, they come to see you at your clinic, stage 3, stage 4 lung cancer. What would be your general recommendations?
Well, you have to drink guayabano leaves, ginger, garlic, asparagus, and then if you have Boston C, you know, and megadose vitamin C, and if you have pain, pixie dust. And that's it. Just be patient.
And dietary modification.
Yeah, you just have to change your food. You have to change. Why did you develop lung cancer in the first place?
If you're smoking, stop.
Or if you're around people who are smoking, okay, it's better if you go in a air with air that is fresh,
clean air. Because understand, guys, we used to see a lot of folks, you know, who are moms and wives who never smoked, but who developed lung cancer. But then when you start digging into it, they were always cooking.
They were cooking, yes.
They were always cooking with reusing oils, cooking with these oils again and again and again, and breathing.
Or they're using Teflon.
Oils and Teflon.
Yeah.
And, you know, reusing the oil 3, 4, 5, 6 times.
Don't use Teflon.
Until it was black.
If there's one thing, if you're cooking, if there's one thing I can tell you, do not use Teflon and aluminum. That's one of the worst things that you can do for your health. Okay, if you use, because there was an experiment done with Teflon, okay, because that's lined with fluoride, okay, so there was an experiment done with that, and what happened was that there was an animal that was exposed to that, and that bird died.
The gases. Well, the thing is,
he just smelled it,
and
he used, no, there's one, okay, oil also, that's very important.
The thing is, whenever you see an old Teflon pan as well, you notice all the stuff that's missing off the bottom of it? It's Teflon. Where did that go?
In your food.
In your food.
And then you're eating it.
And then you ate it. And your body had to process that.
Yeah. But we don't live in a perfect
world. We don't live in a perfect world. We don't live in a perfect world. The thing is, our health is a result of our choices. And so what we always have to do is make the best choices we can. Control what we can control to ensure we're going to have the best health possible, okay?
Yes.
The thing is, when folks say, well, what is an alternative, you know, for bread or rice or pasta? You know, the thing is, we'll start introducing some different alternatives, but you have to realize you get sick because of the choices you make. And if you don't want to change the choices, you can't expect to return back to health. So sometimes it's about making sacrifices. If a person's accustomed to eating rice with every single meal, well, you gotta make a change, especially when they're sick. You know, you can't continue to do that. You know, for example, if I keep smacking my thumb, Mom, with a hammer, and I tell you, gosh, my thumb sure does hurt, the first thing you're gonna advise me to do is to stop smashing my thumb with the hammer, right?
You're right.
That's right. You gotta change it.
So for all of
non-calcified nodules in lungs.
So for non-calcified nodules in lungs, the best thing that you can do is pixie dust and megadose vitamin C. There was one testimonial. Did you see that? La Forest, she gave me a testimonial.
Those are non-calcified nodules, weren't they?
No, those are cancer.
Yeah. A little different.
So she took the natural cancer killer recipe that I had. It's in my book for all of you who do not know the recipe. It's all in my book. So just
it's also
go
in the
by
cancer patient support group.
Yeah, it's all in the cancer patient support group. So just go there. And then she was taking megadose vitamin C. So from I think 5 cm, so it went to 2 centimeter in just a matter of 2 months. So thank you very much, La Forest, for sharing us your story. It's a wonderful story. You're an inspiration to us. Yes.
You're the inspiration.